Diaper rash can happen for many reasons, and often several factors combine at once. Mixture moisture from urine and stool creates an ideal environment for skin breakdown and bacterial growth. Friction from diapers rubbing against sensitive skin makes irritation worse, especially as your baby moves more. Chemical irritation from urine, stool, harsh detergents, or wipes with alcohol or fragrances can quickly trigger inflammation. Yeast infections thrive in warm, moist areas. That's why diaper folds are often affected. Bacterial infections can appear, especially during antibiotic use, which disrupts normal skin bacteria. And finally, food sensitivities or sudden diet changes can alter stool acidity and increase irritation. Prevention is the best medicine when it comes to diaper rash. Change diapers frequently. Check at least every 2 hours and immediately after a bowel movement. Clean gently with plain water or fragrance-free, alcohol-free wipes to avoid stripping the skin. Give your baby some air drying time before putting on a new diaper whenever possible. Apply a barrier cream, zinc oxide or petroleum jelly, with every change to create a protective layer. Ensure the diaper fits properly, not too tight and not too loose. For cloth diapers, use fragrance-free detergents and rinse thoroughly to remove residue. And if rashes keep returning, try switching to a different diaper brand temporarily. It can make a big difference. Call your pediatrician if the rash doesn't improve after 2 to 3 days of consistent treatment. Diaper rash can be so frustrating for parents and uncomfortable for babies. But with the right care, it clears fast. What prevention tips or treatments worked best for your little one? Share your experience in the comments to help other parents. Like this video if it helped you understand diaper rash care, and subscribe for more practical baby health guidance.